Hi, my name is Maggie. I am married to my husband for 55 years, and I have 2 sons. I have a grandson, and I have 2 great-grandchildren. I worked as a secretary my entire life. I love singing in the choir. I also do solo work with the church. I sing with a local community choir, and I do solo work with them. I play bells at church. I love doing that. I love reading. I do studying and I read. I especially love mysteries and thrillers. I read outside on my front porch when it's nice. I love sitting outside where it's nice and quiet and the atmosphere is just beautiful, and hopefully the weather is as well. One evening on my way home from choir practice, this individual pulled out in front of me, and I wrecked into her. And going to the hospital, they did a CT scan. And through the CT scan, they noticed that the enlarged lymph nodes was extreme. They were extensive throughout my whole body. So they had to do another biopsy, and at this time, they determined I had cancer.
Diffuse large B-cell lymphoma, or DLBCL, is the most common type of non-Hodgkin lymphoma, or NHL. DLBCL is a fast-growing NHL. It affects B lymphocytes, also known as B cells, a type of white blood cell that helps the body fight infections. As they develop, cancerous B cells become larger than normal and multiply uncontrollably.
It was difficult having DLBCL during COVID. I felt isolated. I could only contact my friends and family through texting, through telephone, through video chat. It was a difficult time for me.
I've supported her by being with her, taking care of her, and just be here 24/7. We've had some stressful things happen in our life, and we were both there for each other. And I just dropped everything and let the world just keep on going by, and she was my number one, and she still always is my number one.
Initially, when I was diagnosed with the cancer, they prescribed 6 cycles of chemotherapy. During that chemotherapy, I had some problems that the medicine affected my heart. So I could not continue with that. They had to back off on the amount they gave me, and because of that, it did not eradicate the cancer.
If she has cancer, I have cancer, right? Because it's a team. It's a team effort, and you have to work as a team. You have to pull together, you have to stand together, be faithful to one another.
When the cancer came back, it was scary for both of us. We had a lot of trips to be treated for the DLBCL, and it took a lot of our time. It completely changed our lives. We could not live our normal lives because we had to live around this diagnosis. When the cancer returned, my original oncologist referred me to another oncologist who specialized in DLBCL. He said that there were 4 options available. 2 of the options would not work for me, but he said one that might work is MONJUVI.
MONJUVI, tafasitamab-cxix, is a prescription medicine given in combination with lenalidomide to treat adults with certain types of diffuse large B-cell lymphoma, DLBCL, that has come back, relapsed, or that did not respond to previous treatment, refractory, and who cannot receive a stem cell transplant. It is not known if MONJUVI is safe and effective in children.
I did come home and go online and look up MONJUVI. There was a lot of information available on the website. One of the things I did before I went for my infusion was to write any questions down. I did this on my phone so that I had it available, and when I got there, I was able to ask them, so I had everything clear in my mind as to what was going to happen. With the treatment of MONJUVI, I would go to the local hospital to have an IV infusion, and I would take medicine by mouth at home. The nurse would hook me up for my infusion, and it would take a while for it to run. And while that was running, I would either watch television that they had there, or I would read because I love to read. The nurses did explain that there could be side effects with the MONJUVI. I was just to be aware of them, and they did explain what they were.
Important information I should know, including possible side effects, about MONJUVI. MONJUVI, tafasitamab-cxix, may cause serious side effects, including infusion reactions, low blood cell counts, and infections. The most common side effects of MONJUVI when given with lenalidomide in people with DLBCL include respiratory tract infection, feeling tired or weak, diarrhea, cough, fever, swelling of lower legs or hands, and decreased appetite. Continue watching to learn more about these and other side effects.
I have a lot of gratitude for my husband, for my family, for my 2 sons. They've been there to support me the whole way. My family, my friends, they would always touch base with me to see how I was doing, to make sure everything was fine. So I have a lot of gratitude for everyone that's been around me. We're on a mission to do more traveling and spend more time together. We especially love to travel to different parts of the country and even out of the country. My husband and I are both looking forward to a cruise we have planned to celebrate our 55th wedding anniversary. I enjoy going out and working in my garden. I enjoy keeping track of my family, especially my grandson and our 2 new great-grandchildren. I love speaking with them and seeing pictures of them. It is hard hearing that your DLBCL has returned, but I would recommend that you keep an open mind, stay positive, keep in touch with your family and friends because they're going to uplift you and keep you positive. My life now since the DLBCL has changed. I'm not as active as I used to be physically. It seemed to affect my body where I'm not walking as much as I used to. But we still, both my husband and I, keep active. He is active outside as well as I am, and I'm active in activities in the home and keeping things going here. My outlook is very positive. I love life, I live it happily, and I'm just glad to be here.
Important safety information. What are the possible side effects of MONJUVI? MONJUVI, tafasitamab-cxix, may cause serious side effects, including infusion reactions. Your healthcare provider will monitor you for infusion reactions during your infusion of MONJUVI. Tell your healthcare provider right away if you get fever, chills, rash, flushing, headache, or shortness of breath during an infusion of MONJUVI. Low blood cell counts, platelets, red blood cells, and white blood cells. Low blood cell counts are common with MONJUVI, but can also be serious or severe. Your healthcare provider will monitor your blood counts during treatment with MONJUVI. Tell your healthcare provider right away if you get a fever of 100.4 degrees Fahrenheit, 38 degrees Celsius, or above, or any bruising or bleeding. Infections. Serious infections, including infections that can cause death, have happened in people during treatment with MONJUVI and after the last dose. Tell your healthcare provider right away if you get a fever of 100.4 degrees Fahrenheit or 38 degrees Celsius or above, or develop any signs or symptoms of an infection. The most common side effects of MONJUVI when given with lenalidomide in people with DLBCL include respiratory tract infection, feeling tired or weak, diarrhea, cough, fever, swelling of lower legs or hands, decreased appetite. These are not all the possible side effects of MONJUVI. Your healthcare provider will give you medicines before each infusion to decrease your chance of infusion reactions. If you do not have any reactions, your healthcare provider may decide that you do not need these medicines with later infusions. Your healthcare provider may need to delay or completely stop treatment with MONJUVI if you have severe side effects. Before you receive MONJUVI, tell your healthcare provider about all your medical conditions, including if you have an active infection or have had one recently, are pregnant, or plan to become pregnant. MONJUVI may harm your unborn baby. You should not become pregnant during treatment with MONJUVI. Do not receive treatment with MONJUVI in combination with lenalidomide if you are pregnant, because lenalidomide can cause birth defects and death of your unborn baby. You should use an effective method of birth control, contraception, during treatment and for 3 months after your last dose of MONJUVI. Tell your healthcare provider right away if you become pregnant or think you may be pregnant during treatment with MONJUVI. Are breastfeeding or plan to breastfeed? It is not known if MONJUVI passes into your breast milk. Do not breastfeed during treatment and for at least 3 months after your last dose of MONJUVI. You should also read the lenalidomide medication guide for important information about pregnancy, contraception, and blood and sperm donation. Tell your healthcare provider about all the medications you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 800-FDA-1088 or www.fda.gov/medwatch. You may also report side effects to Insight Medical Information at 1-855-463-3463. Please see the full prescribing information, including patient information, for more information about MONJUVI.